The state has stepped in to oversee management of a nursing home in southeast Portland where around 50 residents and staff members have tested positive for coronavirus. State health officials say 14 deaths at the facility likely are attributed to the virus, the largest cluster in the state. Jennifer Dowling live tonight to explain what DHS is doing about it. Jennifer?
Good evening. The director of DHS says that the situation at the facility had become so life-threatening that they decided they had to take action, in part due to a list of violations by staff there. He said the state decided that more aggressive action was needed.
About 2 weeks ago, we became aware that the situation was escalating.
OHA spokesperson Steve Allen says Multnomah County reached out about serious coronavirus concerns at healthcare at Foster Creek 2 weeks ago.
On that Friday evening, we were assisted by Providence Hospital, who admitted 4 patients to that facility for further assessment.
DHS says the facility was given protocols to follow, but that didn't happen. And in later inspections, DHS found several violations. The report stating the residents of the facility are at risk of immediate jeopardy. That is because the facility's failure to comply with DHS's rules has caused or is likely to cause serious injury, serious harm, serious impairment, or death to a resident.
Action we took was to decisively engage with the facility and make changes to management structure and to intervene medically when we believe that those residents were no longer safe.
The statement of violations dated April 10th showed that faculty and staff weren't following CDC long-term care guidelines. They provided incontinent care without wearing a gown and were observed to not always wash their hands after removing their gloves or after touching their face masks, and were observed to work across units, another violation. In response, DHS decided to impose a license condition at the facility that restricts admissions and visitations and turns control over to a temporary management consultant.
Both DHS and OHA provided guidance to the facility in earlier visits about what needs to take place, and then in subsequent visits, when we observed that those things were not being adhered to, the current order was issued.
DHS went on to say that they had assessed all residents at the facility now, and 20 were taken to the hospital for care and treatment. When asked why they didn't act sooner, the DHS director said that they don't manage those facilities. They oversee them, and he said as soon as they realized there was escalation there, they stepped in and did that license notification. Back to you.
All right, Jennifer Dowling, thank you. Another